A very good evening to you and welcome to the national news broadcast on ChannelEye. We are ready to bring you the top stories from home and around the world. I'm Natalia Veervardhana.
Good evening, I'm Clifford Richards. First of all, we take a look at the headlines.
Travel restrictions are to be imposed throughout the island from 11 p.m. tomorrow till dawn on the 17th. The President reiterates that the decision to utilize organic fertilizer has been taken in the interest of a healthy future generation. 30 newly constructed corona treatment centers have been declared open. 600 doses of the Sputnik V vaccine is to be received by Sri Lanka in the next 2 weeks. The toll of the corona-related deaths in India exceeds 250,000.
Moving on to the stories in detail. 13 COVID intermediate treatment centers constructed in several hospitals in the island by the Sri Lanka Podujana Peramuna under the theme Samata Samasitin were handed over to the health divisions today. The project has been implemented according to a concept of founder of the Peramuna, Basil Rajapaksa. A 50-bed COVID intermediate treatment centre has been established at the Mulleriava Teaching Hospital. General Secretary of the Sri Lanka Podujana Peramuna, Parliamentarian Sagar Kariwasam, officially handed over the centre to the Director of the hospital, Dr. Priyantha Karunaratne, today. In addition to the 50-bed ward complex, a 200-bed provisional ward complex is being constructed. The SLPP has spent nearly 60 million rupees in this connection. A stock of medical equipment were also handed over to the director of the hospital by the parliamentarian Major Pradeep Undugoda. A group of parliamentarians including Minister Sarath Veerasekara were present on the occasion. The COVID intermediate treatment centre constructed at the Panadura Base Hospital was also handed over to the health divisions today. The centre is comprised of 50 beds. People's representatives of the Podujana Peramuna and director of the hospital Indrani Godakanda was also present. SLPP parliamentarian Sanjeeva Edirimana handed over to the health divisions a 50-bed COVID intermediate treatment centre set up at the Pimura Base Hospital in Agalavatta. A temporary COVID intermediate treatment centre has also been constructed at the SLPP by the SLPP at the Minuwangoda Hospital premises. Minister Prasanna Ranatunga handed over the 50-bed COVID treatment centre to the health divisions today. A 50-bed intermediate treatment centre erected at the Kahavatta Base Hospital handed over to director by the SLPP parliamentarian Akila Ellavala. The health divisions have also received newly constructed 50-bed COVID intermediate treatment centres at the Kosgama Regional Hospital as well. The Hospital Administration Authority has also directed the relevant equipment for the new ward. Parliamentarian Pradeep Undugoda, Avisavila Chief SLPP Organiser, Attorney at Law Ravindra Jaisingh and Director General of the Sri Lanka Rupavahini Corporation Ajit Naragala also attended the event. The Sri Lanka Podujana Peramuna has also established a 50-bed COVID treatment centre at the Damadeni Base Hospital. It was handed over to the health divisions by Minister Johnston Fernando and Namal Rajapaksa. State Minister Professor Channa Jayasumana presided over the ceremony in connection with the handing over, and that's at the Navagamua Regional Hospital. A group of other SLPP parliamentarians also attended the occasion. Minister Prasanna Ranatunga handed over to the health divisions the 50-bed COVID intermediate treatment centre at Meerigama Hospital. SLPP parliamentarian Kokila Gunawardhan also attended this function.
Meanwhile, State Minister Sudarshini Fernandopulle says that Sri Lanka is scheduled to receive 600,000 doses of the Sputnik V vaccine in the next 2 weeks. She made these remarks at a media briefing in Colombo today. State Minister Sudarshini Fernandopulle said that the second dose of the vaccine has been provided to 221,363 persons since the 26th of last month. The minister added that 600,000 more persons are needed to be inoculated with the second dose. She has also recalled the excellent cooperation extended by the President and the State Pharmaceutical Drug Corporation in the handing over of the vaccine. Minister Fernandopulle also said it was due to the close diplomatic connections between the President and the Indian Prime Minister that Sri Lanka was able to commence the vaccination procedure on the 29th of January. She added that a shortage of 600,000 doses still exists. She also said that they are engaged in strenuous efforts to stock more of AstraZeneca vaccine. Measures are underway to conduct talks with relevant countries to receive the second dose of the vaccine. Meanwhile, Sri Lanka has already received the 15,000 doses of the Sputnik V vaccine. 11,334 vaccinations have been successfully conducted utilizing this vaccine. The minister added that when they send the report to Russia, they are hopeful of receiving a further 600 doses of Sputnik vaccine within 2 weeks. Inoculation under the COVID-19 immunization program has taken place at several locations in the island today as well. Army Commander General Shavendra Silva has presided over the vaccinating program at the Office of the Medical Officer of Health, Pitakotte, today. The Pitakotte Moich has organized the program with the assistance of the 3 armed forces. Vaccinating of 30,000 employees in 54 institutions in the Biyagama Free Trade Zone has commenced. The Biyagama Medical Officer of Health Office says that so far nearly 2,000 employees have been inoculated. A program to provide the Chinese-manufactured Sinopharm vaccine has taken place at the Dompe Medical Officer of Health Office. Around 1,200 workers were reported to have given the first dose of the vaccine. The Mayurapada Piriven Viharasthana in Palavatta has also conducted a program to provide the Sinopharm vaccine. The Medical Officer of Health Office in Battaramulla was in charge of the program. Another Sinopharm vaccinating program was conducted at the premises of the Homagama Central College today through the intervention of the Homagama Medical Officer of Health Office. Nearly 3,000 persons were inoculated.
And looking at the COVID situation in India, the global tally for the COVID-19 infections climbed above 159.7 million today, while the death toll has risen above 3.3 million. Meanwhile, India recorded more than 4,200 new deaths in the last 24 hours, posting the highest ever death count in a single day since the beginning of the pandemic in 2020. Well, this is the third time in the span of 10 days that India has officially recorded over 4,000 deaths in 24 hours. India has seen over 4,000 deaths on May 8th and 9th. Maharashtra topped the tally again with over 800 deaths. Other states such as Uttar Pradesh, Tamil Nadu, Delhi, Karnataka have also reported over 200 deaths per day. The COVID-19 infection tally in the country saw a marginal increase in comparison with yesterday. More than 348,000 new COVID-19 infections were recorded in the country during the last 24 hours. While the overall tally has seen a slight ebb, the state-wise COVID tracker has indicated that the situation has not yet improved. The head of the main Indian health agency responding to the coronavirus has said that districts reporting a higher number of infections should remain locked down for another 6 to 8 weeks to control the spread of the rampaging disease. Dr. Balram Bhargava, head of the Indian Council of Medical Research, said in an interview that lockdown restrictions should remain in place in all districts where the rate of infection is about 10% of those tested. Currently, more than 500 districts in India have a test positivity rate of above 10%, including major cities including New Delhi, Mumbai and Bangalore. Several states have introduced varying levels of curbs on economic activity and public movement to curb the spread of the virus, which are mostly being reviewed and expanded and extended on a weekly or fortnightly basis. Meanwhile, the WHO has said that the variant of the COVID-19 behind the explosion of cases in India has been detected in 44 countries in all 6 WHO regions. Its weekly epidemiological update on the pandemic has indicated that Britain has reported the largest number of COVID-19 cases caused by the variant outside of India. WHO has said that the spread of the B1617 alongside with other more transmittable variants considered as one of the several factors driving India's dramatic surge in the new cases and deaths. India is the world's second most infected after the United States, surging past 23 million COVID-19 cases with a total fatality crossing 250,000 mark today. Meanwhile, International Federation of Red Cross has said that the coronavirus cases are exploding in Asia and the Pacific with over 5.9 million new confirmed infections in the past 2 weeks, more than in all around the other regions combined. Laos has taken just 12 days to see its caseload double, and the number of cases in India has doubled in less than 2 months, more than 23 million.
Head of the National Operations Centre for the Prevention of the COVID-19 Outbreak and Army Commander General Shavendra Silva says that an all-island travel ban will be imposed from 11 p.m. to 4 a.m. with effect from Monday, the 17th of this month. Accordingly, strict travel restrictions will be implemented daily from 11 p.m. to 4 a.m. from the 17th to the 31st of this month.
We are heading towards a long weekend, and I believe that we have been trying to keep the people calm, given all instructions to say that people should keep the social distancing, wear the face mask, and we feel that still you find a small group of people who are still not adhering to these instructions. Anyway, since it's a long weekend, it was decided that there should be some travel restrictions in the island. Thereby, we have enforced the travel restriction from 11 p.m. of tomorrow 11 p.m., 13th 11 p.m. till the 17th 4 a.m. in the morning. So during this period, almost more than three days, we expect the people to be at home rather coming out of their houses around on the roads. And only the essential services and those who are the essential items, goods and food items are being transported are allowed, except for this is not applicable for the health and the defense and the police and also apparel. All others are requested to remain at home.
Initially, we introduced these regulations on the 15th of October 2020 by a gazette notification published by the Minister of Health. So according to that gazette notification, the proper authority, who is the Director General Health Services, can make rules and regulations in respect of COVID-19 time to time. Accordingly, the Director General Health Services has published new health guidelines today, and according to that guidelines, movements of restrictions would be imposed tonight from 11 o'clock to 4 o'clock for a period of 5 hours. Only the essential service vehicles can move on roads during this period. And apart from that, from tomorrow night, 11 o'clock, to the 4 o'clock on Monday morning, the 17th of May 2021, the restriction of movements would be imposed. So during this period, the vehicle movements are highly restricted, except the essential service vehicles. And in addition to that, all the shops should be closed, and the general public cannot move on roads. However, the vaccination program is being conducted in the Western Province. That program is conducted as it is, and the persons who have been informed to get the vaccine, they can go to the nearest vaccination center without any disturbance, and they should not obtain any permit. In addition to that, again, from the 17th of May 2021 to 31st of May 2021, movements of restrictions would be imposed in the night from 11 to 4 o'clock every day. So during that period, again, except the essential service vehicles, other vehicles cannot move, and the persons cannot move on roads. In addition to that, from tomorrow, we are going to implement a special system for non-workers who are going to shops or markets. So if you are going to your usual working place, you can go without any restriction, even in the government sector or private sector. But if you are going to the market, one person is allowed to move from their own residence to go to that places, and the ID card number system is implemented. If it is an even day, if the last number of the ID is a even number, then on that particular day they can go. If it is an odd number, the same theory is applied. For instance, tomorrow is the 13th of May 2021. Then if the last number is 1, 3, 5, 7 or 9, so they are the odd numbers. The 13 is also an odd number. So that ID card holders can move on roads, but they can go to the nearest supermarket or nearest customer center, but they cannot go to other cities by using this particular system. So these are the systems that we are going to implement, especially all these guidelines are implemented in order to control the COVID-19 pandemic, and every time the support and assistance of general public is highly solicited.
We now have a kind of a detailed look at the country's COVID-19 situation. The Minister of Health has declared today guidelines pertaining to the restrictions in the interprovincial transport and authorized common endeavor. The guidelines will become effective till the 31st of this month. However, the implementation of the guidelines have been suspended from 11 p.m. on the 13th to 4 a.m. on the 17th. Accordingly, the state officers should be maintained with a minimum number of staff through a circular issued by the Secretary to the Minister of State Services, Provincial Councils and Local Government. The supermarket should accommodate only 25% of its crowd capacity at a single instant. The number of persons to be admitted to the institute on a given occasion should be displayed outside the institute. A similar procedure should be followed in the admission of consumers to shopping complexes, banks, financial institutions, pawnbroker institutions, retail outlets, open markets and also economic centers. Permission is not being granted for wedding ceremonies until further notice. Registration of marriages, however, could be conducted with a maximum participation of 15 persons, including close relatives. The duration granted for the conducting of a funeral ceremony is 24 hours. Only 15 persons should attend such a ceremony. Liquor sales outlets are permitted to be open from 10 a.m. to 6 p.m. Director General of the Health Services, Dr. Aseli Gunawardena, has taken measures to issue a revised series of guidelines for all persons arriving in the island from abroad, confronting the corona pandemic. Accordingly, children below the age of 2 years who come from overseas are not required to undergo PCR tests. Those above the age of 12 years are compulsory to undergo a PCR test, and it is mandatory for the new arrivals subject to a 14-day compulsory quarantine. Preference will be given to electricity employees in the inoculation program. Accordingly, the provision of the first and second doses to these employees will be carried out speedily and methodically. The Ministry of Power says that the CEB training centre in Piliyandala will be turned into a COVID hospital. The training centres in Kalawana and Samananwala will also be converted to treatment centres. The Ministry of Health has taken measures to provide all necessary equipment to hospitals used in the supply of oxygen to critical patients. Medical equipment valued at 386 million rupees were handed over to the Health Ministry today. They have been provided by the preparatory project on COVID control for the World Bank Fund. The Mahanayaka Theros of the Askiri and Malbatu chapter says that the annual Upasampada ceremony of the Malbatu and Askiriya Viharas will not be conducted. The Health Minister requests the Islamic devotees to restrict the conducting of the Ramazan festival festivities and restrict themselves to their homes. The Health Ministry reiterates that the need to safeguard children from the affliction of the corona disease. The total of 1,429 COVID patients detected today. 1,016 fully recovered patients left hospitals. Accordingly, the total recoveries in the country has increased to 107,657. A total of 24,020 patients are still receiving treatment in hospitals. Governor of the North Central Province, Mahipala Herath, was engaged in a fact-finding tour to look into the buildings that could be turned into COVID-19 intermediate treatment centres. He has inspected the COVID-19 intermediate treatment centre being constructed at the Wahamalgol area in Madavachia. The government has focused attention on turning the dilapidated buildings at the Devalapalle District Hospital into corona treatment centres. After the restoration of these buildings, currently nearly 100 infected persons are undergoing treatment.
A speedy program is underway to provide 10,000 beds for the treatment of COVID-19 patients within 10 days. Minister Namal Rajapaksa is in charge of the program. Numerous institutions in the island have come forward to shoulder responsibility in the 10,000-bed manufacturing project. Minister Namal Rajapaksa has visited several areas in the Kurunegala district, which extends assistance to the program today. He has inspected the work being carried out in this regard through contributions of the engineering workshop of the Kurunegala Municipal Council and the Kurunegala Pradeshya Sabha. The minister was also engaged in an observational tour in this connection at the Podujana Peramana office in Velagoda. The Bingiriya Pradeshya Sabha is also engaged in the bed production process. The Sabha is entrusted with the task of manufacturing 75 beds. Minister Namal Rajapaksa has also inspected work at this location. The work in this connection carried out under the direction of the National Youth Services Council has also come under the supervision of Minister Rajapaksa. 15 beds are being produced at the premises of the Variapala Youth Brigade. The Kobegane Pradeshya Sabha is to provide 30 beds. State Minister D.B. Herath and Kurunagal District Parliamentarian Gunapal Ratnasekara were engaged in an observational visit at the workshop of the Pradeshya Sabha. The Beruala Fisheries Harbour is also producing 700 beds under the 10,000 bed manufacturing program. 600 beds are being produced at the Central Machinery Workshop in Beruala and 100 more beds also by the crew of the Ruhunabutha excavation vessel. State Minister P.L. Nishant has observed the activities at the machinery yard, and meanwhile the Ampara Youth Services Centre has commenced production of 200 beds under the guidance of Parliamentarian W.D. Veerasinghe. The work is being carried out at 3 locations in the district under health guidelines.
President Gotabaya Rajapaksa says that the decision to start using organic fertilizer was taken towards endowing the healthy future generation to the country. The Vistas of Prosperity and Splendor policy framework stated that the whole agricultural sector of the country should be transformed to use organic fertilizers entirely. The President pointed out that the government has been vested with the responsibility to act in accordance with the pledges made to the people. The President expressed these views at a meeting held with the members of the Presidential Task Force in creating a green Sri Lanka with sustainable solutions to climate change at the Presidential Secretariat yesterday. Previous governments have tried to popularize the use of organic fertilizers but have not been able to sustain this practice. The President pointed out that the challenges and difficulties related to this initiative but emphasized that the initiative should be carried out on behalf of the country after identifying the correct strategy. The President said that the government is ready to buy paddy for a higher price than the guaranteed price if there is any reduction in the yield due to the use of organic fertilizer. Therefore, he said that the farmers should not have any fear in the initiative. The President said that the government is ready to bear the cost to ensure that the consumers can purchase rice at the existing prices. The President further stated that the government is ready to provide the necessary facilities if companies that imported chemical fertilizers start producing organic fertilizer. Taking part in the discussion, President's Special Representative and Chair of the Task Force, Basil Rajapaksa, said, "Some battles were lost in the mission to save the country from terrorism. Finally, the country succeeded in defeating terrorism. Similarly, the government is ready to ensure the people's right on a non-toxic meal by overcoming all challenges," he added. The experts in the field pointed out that the transformation of Sri Lanka's agriculture, which has been accustomed to the use of chemical fertilizers since the early 60s, to the use of organic fertilizers should be a special victory bestowed upon the people, similar to saving the country from war. Secretary to the President P.V. Jayasundara and members of the task force on creating a green Sri Lanka with sustainable solutions to climate change were present.
Party leaders of Sri Lanka Freedom Podujana Alliance called on Prime Minister Mahinda Rajapaksa to discuss on several issues, including to direct attention on the accelerated efforts to be taken to control the spread of COVID-19 outbreak. The meeting was held at the Temple Trees yesterday. The attention of the discussion was directed on the steps which have been taken by the government to curb the spread of the COVID-19 outbreak in the country. Discussions were also held on the establishment of additional treatment centres in areas prone for COVID-19 outbreak. The Prime Minister pointed out that the national inoculation programme should be continued in a successful manner. In addition, the attention of the party leaders' meeting was directed on the measures to be taken to avoid any hindrances faced by the COVID-19 patients during the treatment process. The party leaders appreciated the efforts taken by the Youth Front of the Sri Lanka Podujana Peramuna to prepare 10,000 beds within a period of 10 days for the COVID treatment centres.
Chairman of the Sri Lanka Rupavahini Corporation, Dr. Nihal Jayatilaka, has been appointed as the new chairman of the Sri Lanka Standards Institute with immediate effect. He has assumed duties in this post today. The appointment has been made by President Gotabaya Rajapaksa. Dr. Nihal Jayatilaka, who is a well-experienced senior official in the state service, has previously held the post of secretary in several ministries, including the Ministry of Health, Economic Development and Local Government and Provincial Councils. Subsequently, The President appointed him as the chairman of the ChannelEye Rupavahini Corporation. Dr. Nihal Jayatilaka took over the administration of the national television at a period of crucial challenges. State institutions have been entrusted with a higher responsibility in the face of the COVID pandemic. The ChannelEye Rupavahini Corporation was no exemption. Dr. Nihal Jayatilaka, in his task as the chairman of the corporation, has provided accurate guidance to the entire staff of the institution, including heads of divisions, on the procedures pertaining to the controlling of the pandemic and the implementation of state official communiques. As a result, National Television, as the government official media institution, was able to hand over the relevant information to the general public with greater responsibility during this decisive period. Dr. Nihal Jayatilaka has assumed chairmanship of the Sri Lanka Standards Institute at a time when he was engaged in this crucial endeavour. Director General of the Sri Lanka Standards Institute, Siddhika Senaratne, and a group were present on this occasion.
Prime Minister Mahinda Rajapaksa has instructed the National Housing Development Authority yesterday to focus special attention on the provision of more houses to the low-income earners and the middle class. He has given these instructions to a group of officials of the authority at a discussion in the Temple Trees yesterday. The Prime Minister has also focused attention on this occasion on the proposed housing projects as well as on existing projects. The Prime Minister has pointed out that need to complete construction without delay. He has also ordered to expedite legal procedures pertaining to proposed housing projects in Bambalapitiya and Narayanpita. The Prime Minister has also instructed officials to enlighten the contract company and to implement the projects in a manner to provide housing facilities to a larger number of persons. State Minister Indika Anuruddha, Prime Minister's Additional Secretary Chaminda Kularatne and state officials were also present on the occasion.
Minister of Mass Media Dr. Kehelia Rabukwella was engaged in an observation tour at the Colombo Port City project today. Discussions have been conducted on this occasion regarding a methodology to rectify the misconceptions of certain groups regarding this project. Minister Dr. Kehelia Rabukwella was enlightened during the inspection tour on the progress being achieved in the constructions in this port city. It has been pointed out that in the near future, businessmen as well as general public will receive many benefits from the Colombo Port City project. However, special attention has been focused on the preparation of the methodology to enlighten the masses on the genuine advantages of the project by dispelling erroneous opinions. Among those officials who have accompanied the minister in the tour included the Secretary of the Ministry of Mass Media, Jagat P. Vijayveera, Director General of the Government Information, Mohan Samaranayaka, Director General of Presidential Media, Sudeva Hettiarachchi, Director General of the Prime Ministerial Media, Vijayananda Herath, and Director General of the National Development Media Centre, Milinda Rajapaksa.
Meanwhile, the 3 commemorative stamps issued in connection with the National Vesak were presented to Prime Minister Mahinda Rajapaksa at the Temple Trees today. Minister of Mass Media Kehelia Rabukwella has presented the 3 commemorative stamps and the First Ekava and the Suwaniya card to the Prime Minister. The stamps bear pictures of Buddhist places, sacred and historic importance of Sapumalgaskada Viharaya in Vavuniya, the Madukanda Dalada Viharaya and the Kadurugoda Viharaya, Jaffna. The stamps with denominations of rupees 10, 15 and 45 have been created by artist Palitha Gunasinghe. The Mahasangha, including Venerable Dr. Kirindyas Jithera of the Gangarama Viharaya, Minister Professor G.L. Piris, State Minister Ajit Nimad Kabral, Prime Minister's Secretary Gamini Senarath, Secretary to the Ministry of Buddha Sasana, Religious and Cultural Affairs Professor Kapila Gunawardena, Commissioner General of Buddhist Affairs Sunanda Karyaperuma and Postmaster General Ranjita Ariyaratne have also graced the occasion.
Well, that's it on the news. Do enjoy the rest of the programs. Take care and good night.
Stay safe. Good night.